Stephen Donnelly, Minister for Health, has said that, and it is another positive, I suppose, that there's been a 90% reduction in the fatality rate in the second wave as compared to the first wave. First of all, can we identify why that is? And if we know that, should we be behaving differently now? Because if we have a so much reduced fatality rate, are we still taking the right approach?
We've learnt a huge amount March and April. We know that the fatalities, and it's each one a tragedy for families and loved ones. Over 2,000, we passed that milestone. But we know that in that first wave, many of them occurred in long-term residential care settings, over half. Many of them were in the older age group, and many of them among people with underlying disease. What we've done since then is people have learnt about the particular vulnerabilities of certain parts of the population to this virus, and those people are protecting themselves more, and they're being protected more.
So there is some shielding going on, as it's sometimes referred to.
Clearly there's learned behaviour, both as a society and individually.
NPHET met last night, and you are obviously a member of NPHET. Do you have any, we're hearing that there is some arguments, we're hearing that there is some division about where we go from here. One of the questions I asked Minister Paschal Donohoe before the 8 o'clock news was, if we are still on 300 or 400 cases per day when it comes to the end of lockdown, the December 1st date, will we be exiting it, or will NPHET change their advice and say, no, we have to stay in this level of restriction?
Well, my primary concern, of course, with the healthcare service being with the HSE, but yes, I'm a member of NPHET, and yes, it's concerning that the fall has stalled. We saw a dramatic fall up to last week of 6% per day. In fact, we were the second best performing country in Europe in terms of that drop, and still remain that case when we look at what's happening in mainland Europe. What I would say is, Ciara, is what the better we perform now. We've been asked from the very beginning, what if something happens in 2-3 weeks' time? As if we're passively standing by, passive bystanders watching something play out in front of us. That's not the case. What I would say to anybody listening today is that we still have the power to create the widest possible amount of options for ourselves in 2 or 3 weeks' time. That our value we all talk about as if it's some inanimate figure that means nothing to us. It's the cumulative sum total of 1 million small behaviours throughout society. Every one of us have a part.
And I know you want to encourage everyone to use the last 10 days and to use them wisely, and I think that's very, very good advice.